There's something called fear of positive evaluation. If I do this now, what will you expect of me next? And that's a term that I learned a while ago. And it really was an aha moment for me because children want to please, but they also feel your expectation and pressure. If your child does make progress and you're the kind of parent that goes, oh my God, you made all this progress. Now you can do X, Y, and Z. Your child feels, well, if I do this now, what will you expect of me next?
Welcome back to another episode of Unspoken Words, a Selective Mutism podcast hosted by Dr. Lisa Chipon-Blum and the Smart Center. I'm Brandon, Unspoken Words podcast producer. This episode features our latest installment of our Ask Dr. E series. In the episode, we answer 5 listener questions, including ways to help a homeschooled child make friends, how to deal with SM as an adult, the concept of parental expectations, and more. Before we get started, remember, if you have any questions on anything you've heard in today's episode, we encourage you to ask Dr. E yourself. All you have to do is head to selectivemutismcenter.org/ask Dr. E, that's ASK-DR-E, and enter your question. We read all of your submissions and do our very best to answer them on podcast episodes like this one, in our newsletter, on blog posts, and on social media. Speaking of social media, for the best of this episode and every episode of Unspoken Words, we really encourage you to follow the podcast on Instagram and on YouTube. On Instagram, we are Unspoken Words _podcast, and on YouTube, we are Unspoken Words Podcast by Dr. E, that's D-R-E. So, without further ado, please enjoy the latest episode of the Unspoken Words podcast.
Hey listeners, before we get started, I want to tell you about Communicamp, our 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. It's over 16 hours of parent education and support, as well as 16+ hours of treatment for your child or teen. Spaces are limited and spots book fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form, and our team will be in touch. Let's help your child or teen find their voice. Okay, now enjoy the episode.
Hey, Dr. E, how's it going?
Hi, Brandon. How are you?
I'm good. We're coming off a nice community camp this past weekend. We got some podcasts recorded. Excited to do another Ask Dr. E.
I know. We always get so many questions coming in. We probably should do these every single day, but that's not realistic.
Yeah, I know. We do it once a quarter, which is good.
Well, we have a lot of great content. I'm really excited to share my experience and wisdom with the audience, with the listeners. We have a lot of varied topics, so let's get going.
Yeah. All right, cool. So we have 5 questions here. First question is on bilingualism. Our daughter has SM, diagnosed at age 3, now 5 years old, and in kindergarten. We are raising her bilingual. Her father speaks Swiss, which is the local dialect. Mother speaks Dutch. Now, a third language has come into the mix via her grandparents and TV, which is German. At school and with her playmates, she speaks Swiss, the local dialect, again. With me, she only speaks Dutch. Lately, though, I've noticed she's starting to speak German. I cannot speak Swiss, but I can speak German. We try to be consistent in who speaks which language to her, so she learns them correctly and doesn't mix them up. Which language would you recommend I speak with her in public? It's almost like a riddle.
Yeah, there's a lot here. So your child is 5 years old and she's multilingual. So she's not just bilingual. And she primarily speaks Swiss at school and with playmates. So she is verbal there. And it sounds like you are telling me that she may be having give, take, back, forth communication, which is great in the language that she seems to be the most confident in. When you're saying what to speak in public, my response would be obviously the dialect of the area that you live, because that's where you want her to become confident speaking to waiters, waitresses, store clerks, going out and about in the community, playing a sport, doing an activity. If they're speaking Swiss there, we want to build that up. So if let's say you spoke Swiss, she spoke Swiss, everybody spoke Swiss, but she was selectively mute, we'd be working in that language because that's the language she is the most comfortable in. So we want to
Just
respect
Swiss.
your culture. We want to respect your language. We want her to be exposed to whatever it is that you want her to be exposed to. But to
Mhm.
me, the language that I would be working with her in, at least with interacting with others as much as possible to help her build the social communication skills and confidence, would be the language that is spoken in the area that she lives. So if
Do you
you are
think
not speaking Swiss, certainly speak German with her, but interacting in public to bring her into social communication, it would take some knowledge in Swiss as you're bringing her into those situations, such as offering her choices in the language, having her write and read, whatever strategy she's using the verbal intermediary. So I would say that it would be Swiss. Now, as a parent taking her out, there may be others too that can take her out. So dad can take her out, maybe aunts and uncles, maybe grandparents, maybe family friends. So she's still getting that exposure in Swiss. So with you, we want to respect that. So if you're out and about in a store and you're speaking German to her, that's great. But when it comes to interacting in public, just understand that if you don't speak that language at all, I'm not sure how you would bring her into social communication in the language that is spoken in that area if you don't speak it, plain and simple. So that's how I see it. Unless you can learn the most basics in Swiss to bring her into social communication opportunities. You certainly can do frontline, handover, takeover, all of that to help her engage. But when people start to question her, if she isn't speaking directly to them, even with practicing of common questions, sandwich questions, action plans, hi bye copy game, whatever you're working on, if you could learn that in Swiss, great. If not, understand that you may be limited in that social communication interaction because it's going to be difficult for you to bring her into social communication.
yeah. It's a complicated question because the mom doesn't speak Swiss, but she should speak Swiss in public just because she's living in a place that speaks Swiss,
It's hard
as
to
much as I
overcome.
am.
Exactly. It's hard to overcome selective mutism if you're not speaking the language that the people are speaking in
Yeah.
when engaging and interacting with them. I mean, you can't. So you have to practice in the language that everybody's using. It does now, if let's say she moves to a new country, let's say she moves to Japan and she only knows Swiss, you're going to build it up in Swiss until you can get some Japanese. So, but if she does speak Swiss and the
Mhm.
people in the area do speak Swiss. So we don't want to, complicate things, but at the same time, we want to respect the mom's native language and have her work with her and engage with her. But that could be, out and about, just talking amongst each other. Because if the people don't understand German, that's going to be tough too, because then now you've got a language barrier. So the answer to the question, to make a very long story quite short, is Swiss.
Let's move on to question number 2. My granddaughter, who I homeschool, is in 6th grade and has selective mutism. What are some ways I can help her find and make friends?
Great question. There's a lot here, and I've gotten this question before, which is one of the reasons we're taking this question. Well, a few things that I'm thinking about. I'm going to assume when you're homeschooled, there are opportunities other than just you and her or her working on her schoolwork. There needs to be social communication opportunities with similar age peers. That has to be. So every now and then I hear, oh, I hear you're against homeschooling, Dr. E. And I go, no, 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 no. I am not against homeschooling. I'm all about it. However, what I am against is lack of social communication opportunities. If you're thinking about most children that go to school, they're having opportunities throughout the entire day of interacting, not just non-verbally, but verbally with other children. Because she is preteen and teen, there's opportunities for conversation, dialogue, debating, kind of abstract language, talking about different challenges, describing books, being able to give your ideas and thoughts to a question that's asked, opportunities for play, conflict resolution. There's so many opportunities to communicate. And if you are homeschooled and you don't have that opportunity, that's going to cause you to be not as confident. So I'm going to assume this family has these opportunities, but maybe they're looking for additional opportunities to kind of connect her with more peers. The number one thing that we need to think about is interest. As children age, they find their friends, they find their peers. As I say, they find their peeps through their high areas of interest, just like an adult. If I'm going to want to meet new people, I'm going to be engaged in an activity that I enjoy, whether it's tennis or pickleball or it's chess or art. It's got to be over the areas of interest. So that's what I would say. As far as locating that, one, you can contact the public school and see what opportunities there are. There are community centers that have different activities, maybe a YMCA. Religious groups have different social opportunities and clubs and activities. If she enjoys sports or she enjoys art or she enjoys whatever that might be. Now, what I have done with some families is if your child has an interest that you can do in your home, I'm going to give you an example. One, baking. I had a preteen girl or teenage girl. She was about 14, 15. She loved to bake. They were able to find some other similar age children that also enjoyed baking. So they used exposures to go out and about to a store, picking up the different items. Each time they did this once a week, they always had a different recipe and they would go out and buy the different aspects to that recipe. So that was an exposure. Sometimes they went out with the peers to buy the ingredients needed, came home. This particular child did really well with a write and read or read. So she would read the recipe and that helped her build her confidence in verbal communication, but also helped her build connections. So that's a wonderful way to find peers, just having activities at your own home, because many of our kids have a lot of sensitivities. They may be overwhelmed in loud, large, lots of people environments, especially when they don't know people as well. So having activities in small groups, clubs, activities, either in your home or other out and about activities where there are few individuals present. Again, it could be any interest. I had a boy that loved playing chess. So they had chess opportunities. I had a boy that loved to juggle. He formed a juggling club. And because he really enjoyed juggling and he was good at juggling, that was a big shot role for him. You need the opportunity. And it's going to be over something to talk about. It's going to be something to communicate about, something to engage with. You start having jokes and people start laughing and personality comes out. Now, for a child that's mute, completely mute, it may need to be parent facilitated or adult facilitated to help that along. But to find the friends, to develop the relationships, you need areas of interest. An example was a teenager who enjoyed rock climbing. So they went to a local rock climbing location. They practiced rock climbing. He built his skills. Then they put a notice up in the rock climbing place to say anybody interested in rock climbing, they met at a certain time. So 3 or 4 kids ended up meeting similarly aged, which was interesting because they
Small
put like
group.
an age range. And through the rock climbing, they became friends. They laughed, they joked. They didn't even necessarily talk in the beginning too much, but there was a connection. And for many teenagers, once you're in a situation, they may become verbal. But in addition to that, then they had lunch afterwards or they went out for ice cream afterwards. So the parent may facilitate, hey, let's go for ice cream. And so all of a sudden you have these opportunities where if this child has appropriate social skills, and that's not a challenge, that once they're comfortable, the connection is there and they are either able to communicate or strategies are used to help with communication, the children find their friends. That's how they find their friends.
Hey listeners, we'll get back to the episode in a second. I want to tell you about Communicamp, our popular 3+ day intensive group treatment and all-day parent education and support program designed to help parents, children, and teens overcome selective mutism, social anxiety, and extreme shyness. Over 3+ action-packed days, your child or teen will engage in immersive activities guided by expert clinicians that build confidence and communication skills in a supportive, fun, and collaborative environment. Spaces are limited and spots book up fast. To learn more, please find Communicamp in this episode's description or head to communicamp.org and complete our interest form and our team will be in touch. Let's help your child or teen find their voice at Communicamp. Let's get back to the episode.
All right, let's move on to question number 3. This one's on adults. This one's interesting. I am an adult male in my 30s. I've had SM as a child from ages 3 to 7. Eventually, I got over it through some therapy and medication. As an adult, I'm functional. I have a job. I can speak to others. I'm overall independent. However, it hasn't always been smooth. I'm still very shy. I have anxiety and depression. I tend to isolate myself a lot and have trouble maintaining friendships and relationships. I really recently started seeing a therapist, which helps. I'm sure there are many like me who had SM as a kid, but still have lingering issues as an adult. Do you have any advice on how I can deal with my current situation?
This is a great question, and we do get similar questions. A few things. Number one, I'd want to understand what issues mean. I'm assuming social communication confidence here, the
Mhm.
ability to be confident in social interaction. You said that you have difficulty kind of maintaining friendships and relationships. I'd want to know, do you feel that you can read social cues well and understand the nonverbal language of communication? Sometimes that's difficult. I'm not saying by any means this is the case, but are there other comorbid or other challenges you may be having other than having a timid temperament? We do see individuals that have autism spectrum. I'm not saying that's what you have by any means, but inability to read social cues well and social language and things like that. So if that's playing a role, definitely working on that with the therapist or somebody that has expertise in that would be something to consider. Some adults I work with have difficulty with some of the other whys. They may have difficulty with processing language. They may have difficulty expressing themselves verbally. So again, I don't know if any of that's coming into play. I'm going to assume it's social communication confidence and that when you're comfortable, you have appropriate social skills. So to me, it's probably lacking in confidence. What I do with adults is we want to really navigate a social communication opportunity. So some of that would be, where am I going? Who's going to be there? What can they ask? What would be my answer? What can I ask? And really beginning to navigate social communication situations. When it comes to maintaining friends and relationships, I think that's a whole kind of separate topic because I'd want to understand what is getting in the way with that. Because if you have appropriate skills and once you're comfortable, your confidence is there, then I'm not sure what else may be going on that's affecting your relationships that are, maintaining friendships and relationships. So I would, as a clinician, want to dive into that a little bit more. And it's really difficult to answer that. But opportunities in terms of social communication in lots of different situations will certainly help. I talked about action plans, predicting questions that can be asked. We talked about greetings, maybe that we can think about and kind of taking your anxieties and worries and fears and kind of breaking them apart. What is it specifically you're anxious about? And then kind of diving into that a little bit deeper and figuring that out. And then kind of tease it, like I said, teasing it apart and really working through it. Because this
Yeah.
is kind of like a really open ended question. Issues to me, assuming our social communication confidence. So, how can we build that confidence? And that's practicing communication opportunities and
Yeah.
sometimes in a very kind of navigation way of knowing what, when, where, and how, and questions off questions and so forth. And again, these are things we work on with adults all the time. So
Mhm.
definitely speak to your therapist about navigating the kind of a social communication interaction, whether it's with people you're not as comfortable with, like in stores and restaurants, predicting those common questions, going through the kind of map, a
Mhm.
hostess, a waitress, asking for things, initiating in these situations with aunts, uncles, relatives, things like that, kind of coming up with what types of questions are people going to ask you? What could you ask them? What is it going on in their life? Is there a holiday? Is there a skill they have? Is there something unique that you can ask them about? Again, this we can do hours on this question. It's really about figuring out how to navigate through social communication interactions.
I think what you said in the last question, question number two, is actually relevant here as well. It's going to areas of your interest, right? So if this person maybe has a job they don't love, I'm just assuming they're working a job every day. Maybe they find maybe it's working out or maybe it's chess. It could be anything, obviously. If they start surrounding themselves with people that are also interested in those activities, that might help with their confidence, right? And these issues that they're mentioning.
Yeah, for sure. And definitely if they have confidence in that skill, that's a wonderful area. I think the thing that stands out the most to me with this particular question is I have trouble maintaining friendships and relationships.
Mhm.
So I want to really encourage this individual to kind of seek out why that's occurring. In other words, once you're comfortable, once you're with them, like we can set up the world in terms of finding your areas of interest. You have confidence in that area of interest, but if it's and navigating through a social communication opportunity, but that's just the start.
Mhm.
Once you're there and your anxiety is lower and you can verbalize, do you get comfortable enough to have free flowing back and forth, give take of communication and conversation?
Yeah.
And if that's
Let's
held up either through lack of understanding the nuances of social language, the kind of the social puzzle that's difficult to figure out, that will impact relationships. And I just feel that, yes, we can help set you up with kind of the map. But once you're there and you're able to talk and you're able to kind of understand the conversation of what would be logically next, it's the nuances, it's the subtleties, it's the unpredictabilities. And if
Yeah.
that's a challenge, you definitely need to talk to your therapist about why that particularly is a challenge.
Let's move on to question number 4. This one's also on adults. What are next steps if exposures aren't working? I grew up with SM and eventually became a teacher. I feel I have exposed myself throughout my career, yet I'm far from comfortable. For example, I would never say a word during any of our staff meetings, despite always being in them. For example, I would never say a word during our staff meetings, despite always being in them. Do you have any advice for someone like me who is in a position to make progress, but just isn't? Should I get a new job?
This is somewhat similar to the last question.
Yeah.
So I'm going to kind of tackle it by the things you said. What are the next steps if exposures aren't working? Exposures is a very broad term to me. How are you navigating exposures? One of the things that I talk about often in my podcast, but we do during treatment is how to navigate an exposure, how to do an exposure specific to you. It's not just go out and about and ask a question. It's where are you going? Who's going to be there? What can they ask? What is your answer? What can you ask? And really navigating that in kind of a very stepwise fashion. We call those action plans. I can't emphasize those enough for verbal individuals, how it's so important and to predict questions that can be asked in different settings because people are going to ask similar questions in different settings. When you see a neighbor, they're going to say, "Hey, how you doing? How's your summer going? Anything going on this fall?" Or if it was around a holiday, "Hey, what plans do you have for Labor Day? After Labor Day, wait, what'd you do for the holiday?" You start to kind of predict these types of questions that are going on. If you haven't seen someone in a while and you know them, "Hey, what are you up to? Are you working? You're going to school? Hey, what's your job? What do you think of the political nature of the country right now?" Whatever that question may be,
I don't know about
let's
that
hope
one.
they, yeah, let's hope they don't ask that question. It's very confusing time. So I would say that these are the ways we navigate exposures. The simple script approach of pre planning, writing it out, verbally initiating in a store. "Hi, do you have thanks? Hi, where is the thanks?" Kind of navigating. I'd want to know what her specific challenges are in terms of why exposures aren't working. If it's just building overall social communication confidence, it's kind of the ongoing practice of it and really navigating through and then looking back what went well? What was a challenge? This is where therapy comes into play. In
Mm.
terms of being part of staff meetings, this is similar to individuals that I work with that are older, whether they're in high school or they're in college and they're in class. That's similar to a staff meeting. What we usually try to do is have the ability to write and read. In school, we can set it up where they're near the teacher. So the teacher might turn to that individual and ask questions. But in staff meetings, is it possible for you to think about questions in advance, write them out, and read it? Is it possible to kind of predict what might be asked in those staff meetings and write out what your answer might be and read it? A lot of these staff meetings, either they're in person where you could have something written on your phone in notepad, or perhaps it's, written out on a piece of paper. But when questions are asked, having the ability to write and read in that moment. It's amazing how write and read strategy, the script approach works so well with so
Mhm.
many individuals. It helps them process. As far as switching jobs go, that's a whole nother aspect to this question because if you're happy with your job, you enjoy what you do in your job itself, I would not think about getting a new job. What I would do is work with somebody that can help you navigate these questions that you
Yeah.
have to really pull it apart and go through the challenges and kind of, navigate it, really know how to work through the social communication opportunities that are specific to you. That's what you need rather than just move to a new job because the challenges that you are having in this job may come up in a different job. So the question is, do you like your job other than some of these isolated situations, or do you just not like your job at all? So again, if you don't like your job, that might be like, I don't like what I do, even when I'm not speaking, then yeah, maybe this isn't the right job for you. But
Yeah.
if you like your job, you love what you do, you feel very rewarded, you're a teacher, you enjoy teaching, and that's a big shot role, right? You are teaching, so people are looking to you. And that's often a role that I notice a lot of individuals with selective mutism, social anxiety do well when they are somewhat of a big shot or confident in a situation. It helps them feel better. It lowers their anxiety and they tend to be able to accomplish more. So you can see how that's just not an easy answer for me as far as switching a job goes. I'd want to really help you learn the skills.
Yeah, that last part, the new job, it reminds me of a question that I know we've gotten before on Ask Dr. E, but also you've talked about before and just in treatment. Sometimes people with selective mutism have an easier time interacting with people who don't know them that well because they don't feel like that pressure. And sometimes a change of scenery could be good and just relieve some of that pressure, right? So it makes me think of that. Do you think there's something there, like getting a new job would just kind of get her away from the people that don't think she's ever going to talk, and maybe that might be good, or is that's like a band-aid on a bigger wound?
No, no, I actually think that's a great question that you just brought up. What I find with an adult that brings this up, it's not that as much as it is with some of the younger folks. I really feel it's skill based. If
Mhm.
she's been there forever and everywhere else in the world, she is a confident social communicator and she doesn't have this challenge, then yeah, maybe she's very, very conditioned. She's been there for so long. Maybe she even went to school there. I don't know. But for the majority of adults that I work with, and the way this question seems to be written is this seems to be an overall challenge that in staff meetings, I don't have the confidence. I don't know what to say. I feel like I've done exposures my whole career, my whole life, and I'm still not comfortable. So it sounds like it's in multiple areas of her life. When it's that way in multiple areas of her life, then this is a skill. This is learning how to navigate. So my suggestion would be to find a therapist, someone you can really work with once a week, once every 2 weeks, where you can really navigate these specific challenges because it is about building social communication confidence. But again, I go back to what might be holding you up. Is it your language? Is it processing? Is it sensitivities? Is it social anxiety? Like what else may be going on? I'm
Mhm.
not saying it's this case by any means. And I'm not saying it's this person, obviously, because I want to be clear on that. But the reason I bring up some of the whys of SM is because we often work with adults that don't just have the social anxiety, that these other challenges are getting in the way. I was recently working with an adult, I think she was 36 years old. And when I really kind of dissected and we did the selective mutism evaluation, we found out when she was younger and in school, she had processing challenges. I reviewed some past testing when she was younger. She really had difficulty putting her thoughts together to say it, processing information. Well, this individual that's 36 is still having those same difficulties. So we had to get updated testing to really see, has this improved at all? What are the specific difficulties she's having? And guess what? Really has difficulty with processing information. And turns out she had ADHD. Another individual that I worked with was missed her entire life. She had high functioning autism or social communication pragmatic disorder. And it was really hard to navigate social communication situations. Again, it was similar to the last question. There were the social innuendos, the puzzle of social interaction, that social puzzle, the knowing how to navigate a conversation and be able to read between the lines and interpret body language. That was really difficult for some of these individuals. And so we had to really tackle it from that angle. In this particular case, it could just simply be, and I shouldn't say simply because it's more than simply, but it could be social anxiety left untreated and not knowing how to navigate and feel the confidence in social communication opportunities. And if you go your whole life and don't have that confidence, it just kind of trails behind you. So we have to dive in, tease it apart, and really work and navigate these social communication opportunities.
All right, let's move on to the fifth and final question. This one's on teens and community camp, which we just came out of. So this is a good question. Our daughter is 12, recently attended community camp and made great progress. She was verbal. We were shocked and thrilled. During the ice cream truck exposure, though, she was fearful to go up for a popsicle when we were with her. Dr. E mentioned the term parent expectations as a possible reason why she regressed in that specific situation. Could you please elaborate on parental expectations and give us some strategies to work around it?
Great question. And of course, I'm thrilled of how well she did at Communicamp, and I'm sure you learned a ton too. And one of the things we talked about at Communicamp was parental expectations, but we also talked about how to bring your child into social communication opportunities. One of the examples we talked about was the selective mutism triangle. But in terms of parental expectations, your child has a conditioned way of interacting with you. You've had a conditioned way of interacting with your child. Sometimes that's there all the time. So even though she's made progress, now it's going back with you out and about and it's there. So what we need to do is help you change your ways using the social communication triangle where in the past perhaps you went up to that ice cream truck. One, we now know to prepare. We might script it out. We might approach that ice cream man and rather than say, give your order without preparing, without a script, perhaps, and just give the order, that it may not work because she may not, one, be ready yet with a complete stranger, or two, you do it for her, which you did in the past. So in the past, you went, she'll have the chocolate candy ice cream. And so now all of a sudden she went to camp, she became verbal, and we're expecting her to just go up to a complete stranger. No. What needs to be done is how do you help prepare that social situation so you can be successful? In the past, it could have been either that you gave the order or you told her to go up and give the order without preparing for that social communication opportunity. Now you're going to do that. You're going to prepare. What do you want in advance? You're going to go up. And if your child isn't able to say, I'll have the chocolate candy popsicle, maybe she just needs to write it and read it. And she can say, hi, I'll have the chocolate candy popsicle. Maybe she can do that now. Maybe she learned that skill and she's ready for that. But maybe she's just not there yet. She has to build that up. So maybe now what you do is you bring her in through choice. Did you want the vanilla or the chocolate candy? Just something as simple as that may change the effectiveness of that. So in addition to parent expectation, you have to change your ways. And that's a big part of why we do all day parent education for 16 hours at camp, because we have to teach you how to do these things. So based on your child and your child's needs and where they're at on the bridge, and of course, taking into consideration some of the whys of SM, if that's an issue, like putting your thoughts together to say it, maybe something she's challenged with, maybe it's timidity, whatever the reasons are, we have to help you change your ways, which you learned a lot. But in addition, it's how she sees herself with you. So she, and I see this a lot with teens, they tend to make more progress with individuals that aren't their parents right away because of the conditioned behaviors they have with their parents. So one, with you changing your ways will help. Having open dialogue with your child, really talking about it, what you learned and how some of the skills that you learned can be used in this situation, and kind of just, again, talk about it, working with the therapist continuously. But there's something called fear of positive evaluation. If you were a parent, most likely before Communicamp, because one of the things we talk about at Communicamp and just in treatment in general is that expectation for speech. And talking about, yes, obviously crossing the bridge into speech is our ultimate goal, but we have to understand that not all children are there yet. And we have to talk about where they're at on the bridge and help them understand that as they navigate. And I think just that conversation alone is going to minimize your child's expectation, because maybe the approach in the past was talk, you got to talk, let's talk. If you talk, you need to talk, you should talk, you got to talk. And if that was the case and your child wasn't there yet, what you're doing is you're causing an increase in expectation. and you're causing an avoidance and more anxiety. So as you work through that and you change your ways of talking to her, all of a sudden her anxiety will go down. When she realizes that you do understand and she realizes she understands, all of a sudden that expectation goes down. But I will tell you that a lot of kids, especially teens, if they were in a situation where they felt that expectation, they do tend to make progress even more with others. There's something called fear of positive evaluation. If I do this now, what will you expect of me next? And that's a term that I learned a while ago. And it really was an aha moment for me when I learned that term, because children want to please, but they also feel your expectation and pressure. So if your child does make progress and you're the kind of parent that goes, oh my God, you made all this progress. Now you can do X, Y, and Z. Your child feels, well, if I do this now, what will you expect of me next? And that can cause anxiety, avoidance, and fear, because they're almost afraid to make progress because they fear that you're going to be like, okay, you talk great. Now you can call Aunt Sally and we can go out here and we can do that. Now you can do all these things. And we know with individuals with selective mutism, it changes from setting to setting and person to person. So I hope that gives a little bit of an explanation of the parental expectations and how changing your ways, talking openly, having a dialogue, discussing the bridge, and also, when she is making the progress, rather than, oh, you talk, look, you talk, now you can do it again, lowering that sense of expectation. Just matter of factly, she crossed the bridge and, great job for trying and moving on and not feeding it too much, but just acknowledging that's where she is. Because some of the kids, they're very sensitive to praise. And I think that plays a role as well. I know there's a lot there. And with each of these Ask the Docs, I feel like I can do an entire, honestly, hour-long podcast on every question. And it's hard to go on and on about the question because I don't know some of the aspects to what might be going on in that particular family dynamic.
All right. Well, that's the last question from this episode of Ask Dr. E. Dr. E, thanks for your time, and we'll talk to you soon.
Thank you, Brandon. This was great. Love it.
If you have questions on anything covered in this podcast episode, we want to answer them. Please head to selectivemutismcenter.org/ask DRE. And we'll do our very best to answer them in upcoming podcast episodes, Smart Center newsletters, and on social media. Thank you.